Hi everybody. I know you are all excited to know what is the session today. Yes, the session which we are going to see is that calcium imbalances. So I know you all are wondering what is, ma'am. You're going on discussing on what are the imbalances. Is it essential to know and what to be done? Yes. Being a nurse, we are the person who are the frontline warriors and we must be legible enough to find what is wrong with the patient. You can't blindly just say it is only an electrolyte imbalance. So, being a nurse, that too being the first year graduate, so you can, the person who's going to enroll yourself in BSc nursing first year, you have to know what are the major symptoms and what can be done by a BSc nursing first year. So imbalances is nothing but either it's going to go for increase or decrease. So here we are going to deal with the calcium level. Moving on to the session. So we all know that this is also a mineral. Yes, of course, agreed. And this is also going to maintain the body, especially the bones and teeth. Anybody, any child, even if you go to a kindergarten and ask, okay, can you tell about calcium? Yeah, they are shouting. They're telling, yes, it's white. It's rich in milk, eggs, and they also say that it gives the bone strength. Yes, we all know that. But apart from that, far beyond that, it's also doing certain other important functions, such as muscular contraction, nerve transmission, blood clotting, as well as maintaining the heart stability, that is the heart rate. So the normal level of calcium level in the blood will be 8.5 to 10.5 milligram per deciliter. So when these levels are fluctuating, either it is too high or too low, we call it as hypokalemia or hyperkalemia. So, not wasting the time, we're going to see what are the signs and symptoms of a patient with hypo or hyper. This is calcium level. So, in case when the calcium level is reduced less than 9, we call it as hypocalcemia. And when the blood level is more than 11 milliequivalent per liter, then we call it as the condition is called as hypercalcemia. So emia is blood, cal is relevant to the calcium, and hyper is relevant to increased. So coming to the system-wise manifestation, starting with CVS, then comes your respiratory, then neuromuscular, and GI. So in CVS, you can see that the patient's heart rate is lessening, lowering down, BP is lessened, that is low BP, hypotension. And when you palpate the pulses are very much feeble or reduced. And on the opposite side, that is hypercalcemia, the early symptom is that the patient is having increased heart rate, and in the late symptom, you can see the patient is having or mimicking the symptom of hypocalcemia, that is bradycardia, and which can also lead to cardiac arrest. And you can see the pulses are very much bounding, peripheral pulses. Now coming to the respiratory, often you can see that it is like patient is going to have profound skeletal muscle weakness, which causes ineffective respiratory movement. And on the other hand, when you take the neuromuscular and the hypocalcemia side, you can see tetany, seizures, cramps, and of course here the deep tendon reflexes are very much elevated, paresthesia followed by numbness, and then you can see this numbness is always seen on the lips, nose, ears, and limbs. Some patients are going agitated and anxiety and irritable. On the other hand, that is hypercalcemia, that is decreased deep tendon reflexes, and the muscle weakness is very much profound. That is deterioration, which we call it as disorientation, lethargy, and coma. Coming to the gastrointestinal system, in case of hypocalcemia, there is increased motility and the bowel sounds are high. And when you auscultate, you can see the patient is going to have increased bowel sounds due to the increased peristalsis, abdominal cramps, and diarrhea are evident. It's the opposite on hypercalcemia, whereas there is decreased motility and bowel sounds are decreased. But to know it is hypocalcemia, you have a classical symptom which we call it as Trousers sign, then the shit works. So in Trojan's sign, let us take a deep look on what is it. So being a nurse, we're going to just put it onto the patient's arm and the BP cuff is being tied up. Here we are not going to check in the BP. Instead, we are going to see the response of the patient. So once we inflate the sphygmomanometer on the carpopedal area, you can see there is a big spasm on the carpopedal region, and this is being evident for at least for 3 minutes, which is showing the adduction of the thumb. That is, you can see the thumb is very much close to the fingers. Flexion of the metacarpophalangeal joints, that is, full wrist is now getting flexed. Extension of the interphalangeal joints. Though it is fully flexed, the fingers are extended and you can see the flexion of the wrist. So this is the hallmark symptom of Trojan's sign. Then you have the Shetworth sign. The Shetworth sign is that the contraction of the epilateral facial muscles are being elicited. You can see that by tapping the facial nerve onto the anterior ear. The response is that there is twitching to the lip to spasm of all the facial muscles. So this picture is denoting on the right side, you can see that the normal calcium level, you have a P wave followed by a QRS complex and the T wave, right? And again another QRS complex and P wave and T wave is being followed. In case of hypercalcemia, you can see the QT interval is very much lesser when compared to the normal calcium level. And in case of hypocalcemia, the QT interval is elevated, or you call it as widened QT interval, narrow QT interval. Who are the patients who are at risk? Yes, patients who are having inhibition of calcium absorption in case of hypocalcemia, increased excretion through wound drainage, diarrhea, cystinuria, kidney diseases such as diuretic phases, or might be conditions that may be due to the decreased ionized fraction of calcium. So in case of hypercalcemia, there is increased calcium absorption or decreased calcium excretion, or might be due to certain disorders, endocrine disorders such as hyper or hypoparathyroidisms, and malignancy such as bone destruction tumors, and due to hemoconcentration levels as well. So management, if it is hypo, start with infusions such as either giving oral or IV calcium supplements can be given. You can start with vitamin D and anemone hydroxide. Some patients are high risk for seizures, so start with seizure precautions. And you can advise the patient to have foods that is rich in calcium. On the other hand, in case of hypercalcemia, you're going to discontinue the diuretics, start with calcium IV or PO, that is also going to be discontinued, and then you're going to start with neurostatus monitoring. Loop diuretics can be increased, fluids can be increased. Start with restriction of dietary calcium. So any patient who is having calcium imbalances, either increased or decreased, they are high risk for fracture. So you, being a nurse, keep in mind whenever you are ambulating to minimize the fracture segment. And you can advise the patient to increase the calcium intake if they are in hypocalcemia and decrease the calcium intake if they are in hypercalcemia. So when you take calcium and potassium are opposites. So when there is elevated level in the blood calcium level, the phosphate, that is the phosphate levels are decreasing, and when the phosphate levels are increasing, you can see the calcium level is decreasing in the blood. So these are the common tablets which are used for hypocalcemia, such as starting with calcium supplements and vitamin supplements, and of course some cases are being received with aluminum hydroxide. The being a nurse, what are the do's and don'ts can be done is that the seizure precautions can be done because high risk. So you can start with notifying the time and duration of seizure in case the activity starts. Provide privacy to the patient. Always see that the bed and the linen are being well padded so that the patient is not having any sort of injury, enhancing the safety. And the don'ts is that don't restrict the patient, leave the patient Do not leave the patient unattended, and move the patient into like very much minimal danger, and do not try to open the patient's jaw when the patient is having the seizure activity, or do not try to place anything in the mouth during the seizure activity. To conclude, so it's not about just talking about the bone strength or the teeth strength, it's more than that. Starting with the, as we started on with, it's going to do many other miracles such as heart function, blood clotting, nerve transmission, as well as muscle contraction. So proper nutrition, careful monitoring, and early interventions is essential to prevent serious complications. That's all for today. Thank you for your patient listening. In case if you have any doubts, don't forget to put on to the suggestion box, and then please like and subscribe the channel. Thank you.